proposed Medicare Common Access Card is legislation that was introduced in September. It's the Medicare Common Access Card Act of 2011. That was introduced to combat a staggering amount of fraud in the Medicare system. Government Accounting Office published a report that in 2010 there was $48 billion lost to fraud, waste, and abuse in the Medicare system. And a lot of that fraud stems from fraudulent claims into the system. And what this Common Access Card Act will do is that it proposes pilots to be run using smart card technology for providers, those folks that are filing claims to Medicare, to the beneficiaries. These are our seniors. Today there are 48 million Medicare beneficiaries. The pilots are going to have smart cards issued to providers. Providers will go through, and I use the word provider also to mean supplier. The providers will be issued a smart card. They will go through an enrollment process. It has yet to be defined, but most likely it will be a PIV interoperable smart card. There'll be a biometric captured. There'll be a photo on the card itself. And the patient population will not go through a formal enrollment process. And so what they're going to be issued is a smart card with a PIN. It's going to be very similar to getting a new bank card from your bank. And when the patient goes to the doctor and they see the doctor, they will use their card, present their card, enter their PIN number at the time of check-in. That will authenticate them that they are who they say they are. When they're checking out, the provider or a designated staff person working for the provider will have their card. And what we have proposed, or what we've shown to the government, is the terminals that are being used over in Europe today that have two slots. There's a slot for the patient card, and there's a slot for the provider card. So they would both put their cards in. They would mutually authenticate, the patient using their PIN, the provider using their fingerprint, biometric, to show that the patient and provider were there on such and such a day. It's time-stamped. The claim is digitally signed and transmitted electronically to Medicare. What this will accomplish to root out the fraud is that it's a proactive approach. All of the approaches that have been done thus far to combat Medicare fraud have been reactive. The claims are in the system, and there's a term that's used, pay and chase. Medicare pays the claim, and then they try to track down the crooks based on false claims. To protect beneficiaries, and it's not just protecting beneficiaries, it's protecting providers. One aspect of the fraud problem is the crooks out there. There are people that go and they will steal a doctor's, what they call a national provider identification number. It's an NPIN is what it's referred to. This is the number that a physician will use to file a claim with Medicare. These are out on the internet, and the crooks go and they steal these, pose as the physician, file a claim to Medicare, the reimbursement check comes to the crook, okay, the criminal. The provider doesn't know anything about this. They don't know that their NPIN number has been compromised. So having the providers have a smart card with this NPIN securely stored and encrypted on the chip will protect the providers. At the same time, the beneficiary card will significantly be upgraded. The Medicare card today has a lot of personally identifiable information. Most critical is the claim number. On every beneficiary card, the claim number is printed on the face of the card. That claim number is the Social Security number. And I think we all know what Social Security numbers can do with identity theft, how they can be used for identity theft. So what can be done with the beneficiary card is that Medicare could still use the Social Security number as the claim number, but instead of printing that on the face of the card, the Social Security number will be, again, stored on the chip and encrypted, and that will protect beneficiaries' privacy and security.